So I was diagnosed with testicular cancer when I was 14 years old. I realised that I was sick when I was coming home from holiday. We were actually in America at like Disneyland and stuff, like the typical holiday. And on the way home I noticed that I had a lump on one of my testicles and I was really, really scared. But I ended up telling my mum like 3 days later because I didn't want to be that person that doesn't say and then suffers the consequences, if you know what I mean. So we immediately went to the doctor and the doctor said, "Oh no, you're fine, this is a cyst, it's nothing," so he sent me away. But then my mum was like, "I'm not sure," so we went to another doctor who said immediately that he was sure that it was cancer. And then I had an operation within 3 days, which was really quick. But it was really scary at the time. But I wasn't really, it was more scary for my family than for me, because like I'd obviously done like all the research and Googled everything I could and knew that at the stage that I was at, I was probably going to survive, but they couldn't see that. They were really, really scared anyway, naturally. And so I found that like during the course of my illness, it was my family that suffered more than more than myself, more than I would expect. So I had to undergo 6 weeks of chemo when I was 14, actually turning 15. I went through my 15th birthday in hospital because I had neutropenia, which is like an infection and you lose all your white blood cells, and nobody could come and see me because I was immunocompromised except for my parents, which is a bit grim, but I mean I had a fun birthday with my family anyway. I was still like a bit bad, but like what can you do? I underwent 6 weeks of bleomycin etoposide cisplatin chemo, which is the standard type of chemotherapy for testicular cancer, what are called germ cell tumours, and it was only 6 weeks, but it was still really, really intense. Like I was in hospital for a 5-day cycle and then 2 weeks of recovery and then another 5-day cycle and then 2 weeks of recovery, which was about 6 weeks. So that was 6 weeks out of school as well. And what I realised quickly was, although I was off school, like since all my friends were in school, it was like really difficult to like catch up with them and like keep in touch, so I felt a bit isolated. And even though it was only 6 weeks, it felt like much, much longer. You know, I lost my hair, I lost my eyebrows, I had to go into school with no hair at the end of it, which was a lot, like, to me, it just was happening to me, like I couldn't, like, so I wasn't really that worried, but like, to other people, they would be like, "Oh my god," like people would just cry. Like when I came back to school, people would just start crying, I'd be like, "Why are you crying? This is like, I'm not crying, why should you be crying?" So I didn't really get that like, it would affect other people way more than like, because I had to go through it, so I just like mentally made peace with that and been like, "Well, this is happening," whereas other people like were really affected by it. Yeah, so when I went back to school, like obviously like I thought that I wanted to be like, I'm fine, I can do anything, and then I realised very quickly that I was still like quite tired all the time, and I had a lot of fatigue, and that really affected me, like, because I would always like try and do my best at everything, and when I couldn't, it was really frustrating. And I sort of like countered that quite unhealthily by just like forcing myself to, I went back to school on the 24th of October, which was the earliest day my doctor said I could possibly have gone back to school. And not because I was that big of a nerd, but it was because I really wanted to see my friends again. And I was just so desperate to be involved and be in the chat. Like, and it was a bit weird for them because I didn't think they expected someone their age to have had cancer and to have like gone through the whole chemo cycle, surgery, stuff like that. And like really, it was a bit uncommon for testicular cancer because it's usually people of the age that I am now, like 18 to 25. Whereas I was 14, so that was like quite outside the like standard deviation or whatever for people to have this illness. But like, so for the next few years I would have to go through regular checkups, CT scans, chest x-rays, blood tests. I still do like once a year, but it's calmed down now. The main effect that I have now is that there's still a lot of, not stigma, but it's quite a weighty topic to talk about, but naturally it does come up a lot. Like one of the things I often talk about is that I met Stephen Fry through the Make-A-Wish Foundation. But to tell that story, which is a really fun story, I have to be like, "Oh, by the way, this happened." And then that's like such a downer on everything like in the conversation previously, even if I wanted to tell this really humorous anecdote about meeting Stephen Fry. So that's a bit of a like, I know it's not a massive sort of consequence, but it's the little things that happen like in everyday conversation, like trying to talk to people and then having to drop it in, oh, by the way. And it happens more often than you think, because it comes up quite a lot if you're talking about like cancer, we're talking about, which is good that we are talking about it, but when as soon as you mention that you've had it, then you get like, oh my goodness, are you alright? I'm really sorry. And I was like, I'm fine. Like, it's just like, it's totally in my past now. I don't really think about it. I don't think about it at all on a daily basis. It doesn't like affect me, and I wouldn't even say that it's, some people say it changes your outlook on life, like having it, but I wouldn't even say it's changed my outlook on life, because I wouldn't want to let it like have that big effect on my life, if you know what I mean. I don't know if that's unusual or something, but that's just how I look at it. Like, it's just a thing that happened in the past that I have dealt with, and that it was really difficult at the time, but you know, it happened, so I can't change it. But like, even still, my parents still are really health conscious now about things like that. It's the same thing that I said earlier, it's really affected my parents in the way they look at my health, and they take a much more active interest in my health now. I guess my mum's a nurse, and she would always like get really panicky about illnesses or anything like that, which is great that she's interested, but it's also really annoying sometimes. So like, at Cambridge, I realised that I was going from this environment where everyone knew what had happened to me and everyone knew what I'd been through, to an environment where nobody had. And it was a bit like being gay, because I had to come out again to everyone here, but then I also had to come out again as someone who as a survivor of cancer. And I think it's a bit weird to drop that in Freshers Week, but like, it obviously came up quite a lot in Freshers Week, because people just ask you through your life, but then people stalk you on Facebook and they see this and they're not sure whether to bring it up or not, because it's quite a prominent feature on my Facebook if you look back. So what I did this year was I started raising money for Movember through the college and through myself personally, and we raised over £850 in just over a month. I think that was really, that was a good thing for me. It was like cathartic for me. It was also a way for me to get it out there to everyone that I had, like, that this has happened, so I never have to say that to anyone and so on again, because it was quite a lot of publicity about it. So it was also a way for like me to deal with having to tell loads of people and raise money out of it, which I thought was really good. We had a tea shop. We have a thing called tea shop, where people come and they can have like a cup of tea and a chat in the JCR, and we always have a cancer awareness themed tea shop, which I've now taken to speaking at every year. So that's something positive that has come out of it. And I think also what's come out of it from my friends is that they are more aware. Anyone who knows me, who knew me when I was sick, is now much more aware of the possibility of cancer and the risk of cancer, and they know what to look for, and they know to self-check and things like that. If you think that if you find something, or you find a lump, if you find an abscess, if you find something suspicious, or if you have pain that won't go away, like, it's important to stress that everyone, gets the aches and pains now and again. I mean, we're in Cambridge, but the thing is, if it's recurring and if it doesn't go away, and if it gets worse, then that's the point at which you need to see someone. It's the same thing for lumps and bumps, anything like that. If you're feeling fatigued constantly, and like real fatigue, not just like a bit tired now and again, just like can't get out of bed, those are the kind of things that you want to look out for. And I really advise someone who even has the slightest inclination that something's not right, because you know what is your normal, you know what is normal for you. Just go and see a doctor, go and see a GP, and it's most likely nothing. Like 99% of the time it is something completely benign. It is, a cyst or an abscess or something. You might think that it will never be you, but it could be you, is basically what I'm trying to say. And there is no harm in going to a doctor and just finding out, and they won't get angry at you if you've come to them and it's nothing. Like, they would be happier that you come and they're like, oh no, that's nothing, than if you don't come and you actually end up progressing to a much more dangerous stage. Because when caught early, like, we've got treatments now that are just so incredible. Like testicular cancer, when caught early, has a 95 to 99% survival rate. I would say in a developed country it's around 99% at the earliest stage, which is incredible. So I'd really encourage anyone who even has the slightest feeling that something is wrong, to just go and see a doctor, to go and just get themselves checked out.
Hello, my name's Nick and I'm the president of CATS, which is the Cancer Awareness in Teenagers and Young People Society. The aim of our society is to raise the awareness of the most common signs and symptoms of cancer in young people. So as a society, we run educational events, awareness events and welfare events to raise the awareness of the most common signs and symptoms of cancer and to get people talking about them. In Michaelmas term, we did a Christmas coin event and you may have seen us at Clarence. In Easter term, look out for us at your college's welfare events and also follow our Facebook page to hear more about our Easter egg campaign that we'll be running.
So if what we've learned from Ted has taught us anything, it's that we need to be having these conversations about cancer. Not talking about it doesn't help anyone, and it's really important that we get rid of the taboo surrounding it. What we really want to hammer home here is if there are persistent and unexplained changes, go and see your GP. Most of the time it's nothing, but sometimes it's cancer.
The 5 most common signs of cancer to watch out for are unexplained and persistent weight loss, pain and fatigue, unexplained lumps, bumps or swellings, and changes in a mole. If you notice any of these, make sure you go and see your GP. Other symptoms to look out for include constant headaches, bloating, pain in the pelvis, and painful joints.